My name is Dr. Vesna Cado. I'm glad I can present my co-authored work at the Global Conference on Primary Healthcare and be nominated in the category of Best Researcher Award. The title is Moments of Care: How Interpersonal Interactions Contribute to Luxury Experiences of Healthcare Consumers. Paper that was published in the special issue on unconventional luxury in Journal of Business Research. I will try in the next few slides to present the essence of our research. First, why this research is so important? Because the human touch today is now a luxury good, according to the New York Times, which indicates an increasing luxurification of human interaction and personal care as these become scarcer in times of digitalization. Second, this research shows that pro-social interactions can be an unconventional way to experience luxury, which directly opposes the traditional view that luxury is means to socially show off by material indulgence. That means that unconventional luxuries can be perceived as individually defined luxuries and can include products or experiences often used in daily life, like watching sunset or buying some product that improves your well-being, and so on and so far. And the third reason why this topic is important is because positive interpersonal interactions are especially relevant in medical services, where customers are vulnerable customers that pass through difficult moments, experiencing negative emotions, and positive personal interactions might be used as a tool to overcome these difficult moments, and that's how they can represent an individually defined luxuries for them. Therefore, the goal of our research is to answer the research question and try to provide an understanding of how interpersonal interaction between healthcare consumers and medical staff contribute to individually defined luxury. In order to do so, our research builds theoretical foundation on extant literature on luxury services and hospitality, accepting the definition of Gupta and Weitz from 1999 that experience in service context is defined as any sensation or knowledge acquisition that results for interactions with a service provider. We built our literature review on two pillars: materiality and interpersonal interactions at the service encounters. Our extended research in materiality in service encounters shows that research on luxury services, including medical context, provides insights on positive correlations between elements from physical environments such as material, space, design, or atmosphere, and the experiences and behaviors of consumers, including healthcare consumers. The recent study of Seuss and Modi in 2017 showed that exclusive interiors of hospital rooms add greatly to positive experiences of healthcare consumers. The other pillar that we did extended research on were interpersonal interactions in service encounters. We found that services are people-oriented businesses, and beyond a physical environment, they need people to serve people. The way employees interact with consumers is critical not only for the experience, but also for the outcomes such as satisfaction and loyalty. We found out that out of the ordinary service encounters that has a certain extra, this allows consumers to live through a customized, co-created, and unique service experience that is worth telling others and bring positive behavioral outcomes. The second aspect that we found out in our literature review on interpersonal interaction in service context is that in luxury setting, services encounters as locus for class struggles, which produces class inequalities not only from an employee perspective, as Godwin and Sherman found in their researches in 2007, but also from a consumer perspective. Therefore, interpersonal interaction can be used in order to serve the client in the best possible way. And finally, we found out that in medical settings where negative emotions and biomedical approach are part of the experience, a pro-social and caring approach of interpersonal interaction might be more than valuable. Our extended literature research have showed that there are several research gaps that has to be fulfilled. First, many researchers examine how physical and social cues of luxury services affect behavioral outcomes using experiences as a moderator, but rarely focus on understanding the quality of experiencing interpersonal interactions. Second, many contributions approach luxury from a traditional perspective, but not all the customers are willing or able to have exclusive experiences. For these consumers, individually defined luxuries are psychologically closer rather than traditional luxury goods and experiences. And third, most of the identified studies on interpersonal interactions are done within the context of luxury restaurants, luxury hotels, or luxury stores, but not within a healthcare context and not from a patient's perspective. How did we do this? We explore our research question in the context of the private ophthalmic clinic Sistina Ophthalmologia in North Macedonia, a luxury healthcare network that runs one-day eye surgery model in which patients undergo a refractive and voluntary surgery. During a 3-month period, we conducted 30 interviews with patients of the eye clinic. The number of informants represents common sample size recommendations for exploratory research according to McCracken from 1988. The purpose of the interview was to gain the understanding of the informant's conscious experiences with the service encounter. We additionally selected patients with both high and low incomes and patients who had experienced their eye problem for a relative short or long time to increase the diversity among the patients. The 30 interviews lasted approximately 55 minutes. In collecting our data, we relied on personal interviews covering 3 phases. The first, we asked the interviews to provide information on their daily life with a visual impairment. Second, we asked them on their understanding on luxury and healthcare. And third, we took a deep dive into their personal experiences in the eye clinic before, during, and after the procedure. Phenomenological questioning supported the description of experiences as it emerged in some context. We analyzed the interview material in a multi-step procedure. Each author individually read through the interview and identified emerging codes and categories for each case and across cases. In addition, we moved between the data, material, and theory to identify emerging themes according to Thompson in 1989. Our goal was to produce thick descriptions of our themes to support the trustfulness of our interpretation. What we found out? Our findings revealed that our informants experienced 2 aspects during their stay in the luxury eye clinic. The first one is experiencing material luxury. The second one, and most luxurious aspect, reflects the experiencing of humanity, of moments of care in social interactions between the medical staff and healthcare consumers. The first one, as I said, experiencing material luxury. In luxury medical settings, people experience high-class offerings such as hotel amenities, luxurious in designs, and advanced technology. And many of the informants experience the eye clinic as 5-star hotel, which is mainly for elites, that runs professional or smooth processes, offers the latest technologies, and so on and so far. However, this material luxuriness is not enough for our informants. In their stories, we found another necessary element that enriches material luxury, and that is humanity in interpersonal interactions. At the very heart of our interview stories are the narrations about moments of care or short-lived and pro-social interactions that experience with the medical staff. Moments of care are not experienced continuously along the patient journey, but they appear in 1 or 2 episodes in our informants' narrations. Informants describe their lived experiences through 3 emerging themes. First, experiencing authentic presence. This element of interpersonal interactions means that patients are treated as a whole person rather than as object and disease entity. They reported that they felt that the doctor is with them all the time, or that the personal attention was the true luxury for them. The second element of interpersonal interactions that we found out in our research is the experiencing balanced power relationships, which means that patients are involved in respectful and cooperative interactions with the medical staff. They reported that they were being in a good hands, taking to a close person, or sitting in a cafe. The third element we found out in our research is experiencing interpersonal interaction, which means patients experience emotional bonding and transmission of positive energy. We were very close. I could feel the positive energy between us, or our actions were totally attuned. Obviously, this research, we said, investigate how healthcare consumers experience interactions with medical staff and demonstrate how moments of care contribute to individually defined luxuries during a medical service encounter. Our studies contributes to academic knowledge, but to managerial practice also. Our study contributes to the growing interest of unconventional aspects of luxury by introducing the notion of moments of care. It also contributes to the extent literature on luxury experience services by validating and expanding existing findings on components of interpersonal interaction through authentic presence, balanced power relationship, interpersonal synchrony. And third, research emphasized the temporality of experiences because moments of care are short-lived moments. We also contribute to managerial practice through valuable implications for private and for public medical institutions, because luxurious interpersonal interactions can be offered to the patients via the realization of culture of care, even in the public medical institution. Our study suggests organizational restructuring and reimagining employees' roles to support caring culture, and as well training in communication skills such as mindfulness, which can supports the medical staff to be attentive, open, and to stay focused. Role-playing scenarios, which can help allow to change perspectives and to empathize with the patient's physical and social situation, and Schwartz round that can help allow the medical staff to share their emotions about caring for others. Future research can more diverse cultural context of participants and other medical settings and along the patient journey can be set as future research. Second, employees' perspectives, such as how they experience the giving of moments of care to healthcare consumers. And of course, future studies can investigate how moments of care translate into other service contexts. Thank you very much for your attention. I hope that my research and my presentation was interesting for you and inspiring as well. Thank you very much.